Wow, truly another beautiful day. Another beautiful day to be alive. This is my angiogram, 20th of June 2022, so well over a year ago. And this was done at Sunnybrook in Toronto. And if I scroll down a little bit, you can see that my right ventricle is 100% blocked. My center ventricle is 80% blocked. Plus, I built a couple branches, but they're blocked too, right? 100% and 50. And then my other one is 70% blocked. So basically, I should have been died. See this here, Jeopardy, 94%, almost dead, okay? Almost dead. But then I did some research on the triple heart bypass surgery they wanted me to have. Excuse me, and I saw two different nurses from two different hospitals at the end of orientation videos talking about post-surgery care. And they both said that after surgery, the most common question they get is, how soon can I have sex after surgery? And they both said, hey, the average amount of energy spent during sex is the same as climbing one flight of stairs. So that I figured that meant after surgery, triple heart bypass, I'd be climbing one flight of stairs. So I said no, and I started taking some plants. Oh, I think I forgot to include that in here, but anyway, you can see that I've also had spinal fusion, hypertension, they said, because of my back, right? Cardiac risk factors. Normal valve function and everything, but look at this. When you come down, this is Sunnybrook too. Look at this. Mr. Hayden is a 59-year-old male with symptomatic 3-vessel coronary artery disease. Management options for his coronary artery disease. He tells me he would like to continue with herbal remedies and does not wish to proceed with surgery at the present time. And that's exactly what I did. I switched over to herbal remedies and lifestyle, and I didn't have the surgery. Triple heart bypass surgery they wanted me to have. See this here? This is the Heart Health Institute, see, up here. And this is November 25th, 2022. So this was a follow-up after the June discovery of my heart condition. And it says, denies any significant chest pains, no shortness of breath, and I don't have any. I go on the treadmill, I walk, I'm very, very good. No hospitalizations or emergency, stable. No history of diabetes, blood pressure today was acceptable, continues to use marijuana, and his cholesterol status is being treated with herbal remedies. I use plants. When you buy my book, you will know what they are. Maybe my course. Listen, man. What I've done is I've reversed my friend's diabetes, dementia, and my heart problem. See that? 81 milligram daily, herbal medications, and uses marijuana regularly. Thank you very much, Dr. Dingra. You're amazing. On physical examination, no acute distress. Heart rate was 100 and regular. Blood pressure was 140/90. That's a little bit high for sure, but it's not usually that high. I had walked into the clinic with a mask on, and I had to wear a mask in the clinic while I was getting tested, right? Chest was clear, normal first and second heart sound, no extra sounds or murmurs, no problems. I had an essentially normal electrocardiogram. In summary, 59-year-old gentleman with an established history of coronary artery disease with a previous coronary intervention. I did have a stent. That didn't work. That's where I'm 100% blocked. Evidence of significant multivessel disease at cardiac catheterization. That's when I had my, you saw there my heart. Assessed like to continue with the current medical management, does not really want to proceed with bypass surgery. See that again from another doctor. From a cardiac perspective, he appears to be clinically stable. I will plan to reassess him again in approximately 6 months' time just to see how things are progressing. So, I'm using plants instead of triple heart bypass surgery, guys. This one here, same doctor, but this was this year, June, so a full year after the initial discovery that they wanted to do triple heart bypass surgery for. Says here, last evaluated November 25th. That's what I just read you. Since that time, from a cardiovascular perspective, he tells me he's feeling quite well, denies any significant exertional chest pains, and to suggest myocardial ischemia. Does not describe any shortness of breath. No shortness of breath. You can tell by the way I talk. No history of any significant palpitations. Exercise tolerance is stable overall, but feeling well. The interval history has been unremarkable in that I was assessed by Dr. Tarola, and at that time it was decided I would continue my lifestyle approach of follow-up in about 6 to 8 months. Once again, no diabetes, blood pressure was acceptable, continues to use marijuana, and cholesterol status is being treated with herbal therapies. I am on 81 milligram aspirin daily, herbal medications, as well as marijuana. So you can see very clearly that I didn't have to do the triple heart bypass surgery, right? In summary, Mark Hayden is a 59-year-old gentleman who has an established history of coronary artery disease with previous coronary intervention. He has had some recent evidence at cardiac catheterization. He had a significant multi-vessel coronary artery disease. At the current time, he would like to continue with his ongoing lifestyle approach. I wish him all the best. I will plan to reassess him now in approximately 1 year's time. Look at that. Not even, I'm so good, they don't even want to see me for another year, just to see how things are going. Too incredible. I am too happy and honored to have met doctors of the caliber that I have. And this here, I don't know good or bad. I don't really know what it means, but that's my EKG or whatever you call it. It looks pretty good to me. I don't know what it means, but everything looks kind of in order, right? That's how I see it. And so there you have it. I do not need the triple heart bypass surgery because I use holistic plants. I use plants and I use marijuana, and you can see my heart is 100% blocked, 80% blocked, 70% blocked. So I'll just throw myself on the camera here for a sec. And if you watch some of my videos, you'll see me on the treadmill. You'll see me exercising. You'll see I'm above average physically for a fellow my age. I'm 60 now. Grace and I are doing wonderful. And now that you've seen this, maybe you'll be interested in buying my book or my course, Avoiding Triple Heart Bypass Surgery and Living a much better life. That's what I would like to see us do. I would like to see us live our best and most fulfilling lives. Rock and roll.